Welcome to Healthy Living. My name is Amy Bouton. I'm with St. Tammany Health System, and we're going to talk today on our episode of Healthy Living about women's health. So May is Women's Health Month, and we want to focus on a topic today specifically on women's bone health. We're going to talk about a few other things, but that's going to be our focus today. So with me right now, I have Dr. Karmynah M Helaire. She is a primary care physician at our Folsom clinic, and I want to welcome you today. Thank you so much for joining me.
Good morning. As she said, I'm part of the St. Tammany Health System Folsom Clinic as a family medicine physician. I'm originally from Natchitoches, Louisiana.
Oh, nice.
I went to undergrad at Xavier University in New Orleans, where I majored in chemistry and biology, followed by my master's in public health and medical doctorate at LSU Health Sciences Center in New Orleans.
Oh, nice. Okay.
I proceeded to do my residency at LSU Rural Family Medicine in Bogalusa, Louisiana. And I'm also a U.S. Army veteran.
Oh, wow. And I know we talked before. You and I have talked before. I've had the pleasure of working with you on a couple of things. And I know you have a lovely family, and I know that you like basketball?
I do. So
Okay.
I have been married for almost 15 years. It would be 15 years December 26th of this year. Oh, God, yes.
Wow.
I have two stepchildren, a daughter and a son that are both 16, and I have a 9-year-old daughter who's giving me the blues. She's so active in gymnastics. She keeps us so busy. And I have a 3-year-old who just started his 3-year-old program this month.
Oh, that's exciting.
So we're very excited, and he's excited about it.
That's exciting. Well, we're very happy to have you with us at the Folsom Clinic, the St. Tammany Physicians Network Folsom Clinic. Tell me, when you are practicing in the clinic, what's your kind of care philosophy? What can patients expect when they come to see you?
So my care philosophy is, one, as I told you, I'm from Natchitoches, Louisiana. I'm big on rural health and community because I believe that the community together helps build and grow the community, from having parks, recreation, farmers markets, having great production with the businesses there, keeping the community whole. So when the patients come in, I always tell them, this is our get to know you visit. And we start by getting to know their history, their family history, because all these things connect in how we treat them and care for them. What do they do in the community? What are they putting inside their mouths and their bodies to help them with their health? Do they know their medications? Bring your medication list. Do you have social support, family support? We delve into all those things because family medicine is comprehensive medical care.
Okay.
So.
Yeah, and I know that, you know, just hearing you talk and in conversations that we've had in the past, you really have a commitment to that preventative care, which is really important. Obesity-related conditions, you know, finding issues early. And today, like we talked about in the beginning, and you and I have talked about a little bit before this show, we're talking about women's health specifically, because May is Women's Health Month. But we want to focus on a topic that I don't know, we talk about it a lot, but I want us to talk about it specifically today because bone health is very crucial to women's overall health and longevity, right? So let's talk about a little bit about the prevention and early detection of osteoporosis, which is, you know, a condition of poor bone health. Why is it important to maintain the bone health all of our lives as women, particularly as women?
So let's talk about it. So osteoporosis screening normally starts at 65 and older, unless you have risk factors that for postmenopausal, before 65, and premenopausal women. That can include cancer or kidney failure or some type of other bone health disease or vitamin D deficiency and so forth. So we discuss these topics because there are ways to prevent it before medication management, like exercise. This includes low impact, moderate, or high impact exercise, resistant training. For those community dwelling individuals, we tell them to do physical therapy.
Okay.
Occupational therapy. We talk about diets enriched in calcium and vitamin D, or supplementation with calcium and vitamin D. At least for calcium, about 1,000 to 1,200 milligrams, depending on if you less than 70 or above 70, and vitamin D, 600 to 800 international units, depending on if you're less than 50 or older than 50. Some types of things in your diet, increasing your vegetables, citric fruits,
right.
Beans. You can do milk, things like that, yogurt, cheeses, and there's plenty of wealth that we can provide information about those types of diets and recommendations.
So the key is keeping your vitamin D intake up, right, to strengthen your bones.
Exercise,
right.
Appropriate weight.
Okay.
Low weight can also affect a BMI of less than 20, can affect and increase your risk of fractures
Oh, wow.
from bone loss. So healthy weights also.
Okay. So when should we start paying attention to this as women?
So as women in general, you should be in tune to your health all your life. Correct. But although the screening, like I told you, doesn't occur to 65 unless you have risk factors, we should be honing in on our health, our diets early on. We should be making sure we're enriching it with more than vitamin C and vitamin D, but with other vitamins and minerals. We should be exercising. And the goal is at least 5 times a week, but I always tell my patients, start where you are.
Yeah.
Even if it's 1 day a week, 2 days a week, 3 days a week, start with, if it's 10 minutes, start at 10 minutes with a goal of going 30 to 45 minutes to even an hour. But starting there, making sure you're telling your doctor if you had increased falls, or we can review your medication. So we start early because polypharmacy does occur. Some people have multiple medical conditions that require multiple medications for management.
Yeah.
And sometimes we can reduce those and maximize care in different ways. So having your annual visits, and sometimes more than annual visits depending on how many conditions you have and what we're monitoring. All those things are very important, which also leads to why a primary care physician is important. So having a primary care physician, it's like your nucleus, and it keeps you in tune, and we communicate and attach you to specialists if you need that.
Right.
Which include endocrinologists if you have severe bone health disease, or bone specialists, or even for women, your gynecologist if you need women's health exams and things like that. But we can connect you in different ways. Or if you have kidney failure and you require bone therapies, and we have to make sure we do certain treatments if you have decreased renal function.
Yeah.
Or you've had breast cancer, we can't use certain treatments for your bone health, and we can relay this to your hematologist and oncologist or your breast specialist.
So you're the keeper of all
So those things are all important to stay in connection. So having your primary care physician, we take care of your whole health. And we collaborate with all the other physicians. We're all a big team, including the patient. The patient is part of their care.
Yeah, so that's important to establish at a young age. When you're done with your pediatrician, find your primary care. And when we talk about women's bone health, does bone stop kind of, I don't know, how does bone work? Does it regenerate? Does it build? What does it do? How does it function in our body?
So as we age, and depending on, especially postmenopausal, when we start to lose estrogen and things like that, you can start to have bone loss.
Okay.
And a good percentage of the population, at least 10% of the population of adults will experience some type of osteoporosis. At least 2/3 will have osteoporotic fractures, and at least half of those women will be postmenopausal. So you can start to have this bone loss. But you can, depending on the degree of bone loss, so we kind of gauge it on, it's a scale, it's a FRAX tool, and we do it by a DEXA scan, which is a painless imaging modality that takes x-rays and looks at how the radiation goes through the bones. And it compares it to the younger population to see what degree of bone loss you have. So osteoporosis is if it's less than -2.5, a T-score less than -2.5. So we look at that, or if you have an increased risk of a major fracture of 20% or more, or a hip fracture of greater than 3% or more. So we kind of look at those things to decide where we go from there. And then we go with certain treatments that decrease bone loss, or we have, those are called anti-resorptive agents, or we have anabolic agents that can produce bone. But both agents will also decrease risk of fracture.
Yeah, so there is a treatment. If you do discover osteoporosis, there's ways to manage it.
Correctly.
Okay, good. And for older women who may have paid attention or may not have paid attention to their bone health over time, what is your recommendation? Like if you're seeing me for the first time and I say, gosh, I've never had a bone density test, I don't even know what my vitamin D levels are. What do you say to a person who's for the first time visiting you or their primary care, and they're like, okay, so what are we going to do? How are we going to address this? How do we get to take care of this?
So the first thing, age. The one recommendation from most of our colleges and our screening task force are women 65 years and older.
Okay.
And then also if they are also less than 65 and postmenopausal or have other risk factors, as I said, they recommend screening. And it's normally, when you start the screening at 65, it's every 2 years if you are at risk for osteoporosis or osteopenia, which is the initial bone loss and then progression to osteoporosis, worsening bone loss. So we would kind of screen at that time. But some people have normal bone mineral density, and the recommendation is like every 4 to 8 years.
Oh, that's good.
Just monitoring, and we just, encourage them to maintain the things we talked about: exercise, the diet management, physical therapy if necessary. Monitor your footwear in home. Watch rugs. Watch your lighting in your homes. But the main thing you do initially when you talk to the patients, like I said, get the history.
Right.
Find out if they have any visual impairment that can put them at risk. Find out if they have any comorbid conditions like heart disease or kidney disease or anything like that that can affect their treatment management in the future. So all those things are important, knowing the history of the patient, knowing what's going on. This is why we go back to having those annual visits, with at least annual visits with your doctor, so we'll know what's going on, so we can have you on the proper treatments and follow the proper screening guidelines for bone health.
Yeah, and as you alluded to at the beginning, preventative. Watching what you eat, watching what you drink, exercise. Give me one example of a good low impact exercise for everybody, men and women.
So a good low impact exercises, I would say, stationary bike. Okay. And I like to use that one because a lot of our patients, as they age, they get arthritis and things in their joints. And I say low impact because they can sit there and they can do it. But if they don't have any problems, I tell them to get out and walk your yard.
Yeah, okay. Yeah.
Get out and walk the driveway.
All right.
Or go to the local park and walk.
Okay.
And I tell them things like that. Even chair exercises with resistance bands, movements, strengthening those muscles, strengthening those legs if you don't have mobility or capability to get outside the home.
Okay. Good. Well, thank you for that. Well, I appreciate you being with us. Is there anything else you'd like to add that we didn't cover? Or that you'd like to revisit?
I would just like to add, come visit me at the Folsom Clinic. If you need a primary care physician, I'm ready and willing, and we can get started.
Okay, wonderful. So I want to thank you guys for joining us. Stay tuned because we will be right back, but I want to thank you, Dr. Helaire, for being with us. And like she said, if you need to visit her, she's at the Folsom Clinic. And you can find her information on our website at sttammany.health. So we will be right back.